This is Planetary Health first, Mars next. We're not on Mars. We are actually in Vegas live. We are here at Health, and I got a super amazing doctor here, Dr. John Showalter, and you are driving all things LNS with Linus, right? With dementia care. And I got Thom, who's running a $100 million corporate venture fund. I'm so glad you guys are here. We're going to have a real good discussion today. So if you quickly want to just introduce yourself and tell me a little bit about what you're doing.
Sure thing. So I'm John Showalter. I'm an internal medicine physician. I'm the chief strategy and product officer at Linus Health, which is a digital cognitive assessment company focused on enabling primary care to do neurocognitive assessments and take care of people with early dementia and cognitive impairment. I use the technology in my own clinic and can absolutely attest for its ability to change the paradigm for identifying people with cognitive impairment and actually taking action to improve their thinking.
Awesome. And Thom, just a quick intro about yourself.
Sure. Yeah. Corporate venture capital, single LP fund. We've got a $100 million dedicated fund, but we also invest $1 billion plus off the balance sheet. So $1 billion plus AUM over the next 10 to 15 years. Investing in the medical space. We've got sustainability and mobility as well, but medical is our strongest vertical. It's why I'm here. It's why I'm spending all this time out here. This is great.
Very cool.
So when I think of Planetary Health, like Mars next, I mean, dementia care, I mean, the TAM, yeah. I don't even know that thing, but that is huge. It's a big, sticky problem. So let's get into this.
Yeah. So, I mean, to talk about the size of the problem overall. So about 30% of people over 65 have cognitive impairment. So if you're a Walmart of the world, if you're an employer that has people over 65 working there, you have people with cognitive impairment on your payroll that are affecting how your business runs. Yeah. And if you're just a person, there's a 30% chance that you're going to have trouble doing some daily tasks at some point in your life. And what's really shocking is that could drop to 15%. We know how to drop it to 15%. We can cut it in half. And we're not really doing any of that work.
Wow.
Interesting. So are you looking at cognitive impairment broadly, or are you focusing on a sliver of the population, like catching dementia early? And
so we're focused broadly. We're focused on identifying cognitive impairment in primary care.
Okay.
And that could be from depression. It could be from medications. It could be from vitamin deficiencies. It could be from Alzheimer's or vascular disease.
Sure.
But about a third is immediately treatable, reversible. It is medication. It is depression. It is something that we could do something about. And then the other 70% is going to be some form of progressive chronic disease that leads to dementia. But recent clinical trials have shown without medication, we can slow 70% of people's decline down.
Wow.
So a third's reversible and 70% of the other 70% you can address.
Wow.
And we just we don't have the tools to do it. And Linus is all about providing those tools to get that action done.
And earlier we were talking in the green room, you're sharing, I was saying, well, how does this work? And you were telling me about primary cares and really upskilling that medical assistant. Tell us a little bit about that.
Yeah, so I'm super invested in this space because I missed my grandmother's dementia. So I'm an internal medicine doc. She went from living at home with my grandfather when he passed away to a locked dementia unit in 2 weeks. Wow. So she was very severe and he was just this incredible caregiver that didn't communicate all of his caregiving, but kept her at home.
Yeah.
And we just all missed it. And if a family can miss it, a doc that has 15 minutes is never going to catch it.
Sure.
So 2 and a half years ago, I had a chance to join Linus Health and really bring AI-driven assessments to primary care. Take all of the knowledge from neuropsychiatry, some of the psychiatry that we have, and put it in the hands of a medical assistant and allow them to do the testing. Use AI and technology and analytics in the background to score that in 90 seconds and put the risk and the score and the actions in the hands of a primary care physician to take action in that visit and move from this paradigm where families come to me as a primary care doc and say, hey, I'm worried about mom or dad. And literally maybe 2 years later, we're working with a diagnosis and they've slid and declined for 24 months.
So a big part of our investment thesis is we think that we're trying to democratize access to care. We think that care should go beyond the four walls of the hospital into the patient's home or into the skilled nursing facility or the post-acute care setting where the patient is at. Does Linus sell to the skilled nursing world, the home health ecosystem, or is it just in primary care today?
So our bread and butter has been primary care.
Okay.
But we are increasingly getting pulled to the home as we get better with our technology.
Right on. That's where it's at.
So as we move off of the iPad platform to a web-enabled platform to LLM-enabled conversational platforms, we're getting pulled further and further into the at-home market.
That's awesome.
But based upon this really solid technology that we've put through clinical trials. So we're in our second 1,000-person clinical trial that has full neuropsych testing, PET scans, blood tests.
Wow, that's the real deal.
In order to move it forward. So that we're not just saying like, hey, here's a toy, but this is a real legit medical device that's been through clinical trials. It's got, 30 plus publications behind it. Yeah. It's been concurrently studied with functional MRI, PET scan. And that's what we think really needs to get the adoption up. It's got to be real, diagnostic aid, not just, hey, I looked at this in 100 people. I think it's a good idea.
Cool. The third of patients that you said there's some reversible factors around cognitive decline. What exactly does that mean? So how do you reverse cognitive decline?
So the most common is that you're on a medication.
Okay.
And that medication was fine for you when you were 55. But now that you're 75, it's no longer okay. So the Xanaxes of the world, the Ativans of the world, that we gave out for anxiety, really bad for the aging brain. Okay. I just had a patient where we worked with geriatric psychiatry, got her off those medications, and she's cooking dinner again. And she hasn't cooked dinner in like a year.
That's a big deal. That's a huge deal.
And so that like reversible means truly reversible. We have a patient that had severe anxiety. And it worked until we got her severe anxiety under control. Took her from like severe to no clinical signs of anxiety, and she's able to improve her daily function, take care of herself a whole lot more, and again, really reverse those impairments that are bringing them in, and common things that are reversible, things like vitamin D deficiencies. Interesting. The mental health side of it, or other micronutrient deficiencies are more rare, but there are times where it's simply a supplement that can bring someone's cognition back up to pretty much their baseline.
So Thom, I'd really be curious about data. Like, I know you guys have, like, you're big into sensors. Do you see any sort of connection here with sort of your wheelhouse of your applications, kind of where you think? What are you thinking on this one?
Yeah, it's interesting. So, kind of going back to our home care strategy, right? We, we're never going to play in that space as an operator, but we believe in that space. We're very long only in terms of our investment strategy. And we do think that for care to truly be disruptive and move into the home, you need sensors. You need to take this and turn it into something that's more clinical grade. I mean, I guess my question is to you, can you use a wearable? I mean, I ran into a company here that I'm actually doing some DD on, and love to get your comments on offline. Is they're looking to democratize access to the EEG, right? So it's like a pair of glasses that you wear, and it's giving you a clinical grade EEG. And my wife had an EEG done on her like 6 months ago due to some chronic condition that she had, and she was wearing the 36 LEDs for 2 days straight, right? That's obviously not super scalable, right? And so always looking for ways to, how do we improve the neurospace? How do we improve home care? How do we give doctors the information they need to give, clinical care to the patient in the home?
Okay, so Linus acquired Oral Analytics.
Okay, right on.
In April. And that really gave us the ability to begin to use voice as a sensor, as a signal.
Audio is very much a sensor, yeah.
And they're already having success in ALS trials and
Very cool.
in tracking people's
Very cool.
voice and tenor across ALS. But it's also been shown that it's works really well for mood, for anxiety, for depression.
Yep.
And we have really good evidence from them because we were in a clinical trial together on how effective it is in the cognitive space and the ability to use voice and voice testing to track people longitudinally.
Yep.
So it's, as we get to sensors are not always the best for like a diagnostic aid.
They're not there yet.
But they are fabulous for a N of 1 longitudinal tracking.
Absolutely cool.
So,
Looking for trends, right?
Yeah.
Changes in activity.
Yeah. So, if you have a speaking rate and that speaking rate begins to decline, that's meaningful.
That's meaningful, yeah.
Depending on your condition, if you have a speaking rate and that speaking rate goes up, if you're like bipolar, that could be a sign of, approaching mania or something.
Interesting.
So it's very powerful to have voice as a sensor, and we are definitely longer term strategic vision digging into the voice side and the democratization of voice capture.
Very cool.
Because of consumer technology, we all have it on our hands somewhere.
So based on this conversation, I think it's not sensors as diagnostics, but as ways to alert a clinician when to intervene. Pick up the phone and give the patient a phone call and say, hey, you should come in and see us. Right? Very cool.
Wow, this is awesome. This has been great.
Thank you.
So good to have you on, John. Yeah. So good to meet you, Thom. This has been awesome.
Yeah.
Yeah.
Great to meet you. This was awesome. We should keep talking.
Yeah.
Good deal.
Cool. Cool.